When you're pregnant for the first time, you always worry about yourself, you worry about your growing baby, and sometimes when you're going through this all alone, it can be very frightening. And our patients, they are single moms, they are young, so the midwifery group thought about how we can serve this patient population the best, and Centering Pregnancy was really the best fit for our patients, with providing them with the social support that they needed, the education that they needed, and also the prenatal care all combined into one.
It was a shock. When I realized that I was pregnant, I was happy. And I went into University Hospital, Rainbow Babies and Children, and they asked if I wanted to join the pregnancy program. I had no idea what it was, but I said, sure, I don't mind trying new things.
So welcome back to Centering Pregnancy. So a typical session is about 2 hours long, and depending on where the patient is in her pregnancy is where the education is based. So the first half an hour or so is purely social. During that point, they're doing their own blood pressures, they're doing their own weight, they record it themselves, and then they meet the midwife back on the mat where we basically do a fetal assessment. And the last hour and a half of the group is education, and it's facilitative. So we learn from them, they learn from us.
We would go into the classroom and we would learn different things about our body, our child's health, knowing that you're going to make mistakes and this is your first child and nobody's perfect, and just to be the best mom that I can be.
India is one of our, I call her our centering cheerleaders, and I think that she'll express to you how it just made her a more solid mom to be able to understand not only the physical aspect of caring for a newborn and herself, but also the emotional aspect of it.
So I hope other girls do decide to join the pregnancy program. I think they will really, really benefit from it.
We know the surrounding zip codes to university hospitals have higher infant mortality rates than third world countries. So anything that we can do to get that needle to kind of move, it's best for the community, it's best for the patient, and it's best to give the baby the best start of life.
My son Aiden, he is doing spectacular. He is into everything I guess a 1-year-old should be. He's a very smart little boy, and I really appreciate university hospitals.